topic for today's discussion is what is the ideal weight gain in pregnancy. Hello and hi everyone, this is Dr. Sravanthi Reddy, fertility specialist and gynecologist at Shubha Fertility, LB Nagar. So the topic for today's discussion is what is the ideal weight gain in pregnancy. So on an average, a woman gains around 9 to 15 kgs throughout her pregnancy. So people must be wondering, she just delivers around 3 to 3.5 kg baby. Where is all the weight she is gaining from? So basically, the baby is only 3 to 3.5 kgs, but weight of the mother generally adds up to all the other entities like the growing uterus size, the placenta's size, and the amniotic fluid, and the blood volume, and the water retention. This all adds up to the mother weight, including the baby. So what is the desirable weight in the pregnancy? I mean, what is the desirable weight gain throughout the pregnancy? So basically, it depends upon the pre-BMI, that is pre-pregnant BMI state. So BMI is body mass index, as you all know. So it is categorized according to the BMI. If the BMI is less than 18.5, that is, they're underweight. So the desirable weight should be around 13 to 18 kgs. And if the BMI is 18.5 to 24.9, which is normal weight, they can gain up to 11 to 16 kgs. And if the BMI is 25 to 30, so that is called overweight, they can gain up to somewhere around 7 to 11 kgs. And if they are greater than 30 BMI, that is, they are obese, it can gain up to only 5 to 9 kgs. And the whole parameters differs in twin pregnancies. So basically, the weight, it also depends on the trimesters wise. First trimester, generally you gain up to around 1 to 2 kgs. Sometimes you also lose the weight. It is pretty normal because you will have nausea, vomiting. You might not be eating well throughout that first trimester, that is around the start of the pregnancy to 13 weeks. You might see these symptoms and you won't be able to eat well. So there is a possibility of losing the weight in that first trimester. So it is normal. So that is not to be worried. Second trimester onwards, they'll be gaining around 0.5 to 1 kg per week. So around an average, they'll gain 5 kgs in second trimester and 5 kgs in third trimester. And what are the risk factors if you gain more weight in pregnancy? Generally, you'll tend to have larger babies when you deliver. This even leads to diabetes in the babies when they grow older, and you have high risk of hypertension, diabetes, gestational diabetes in the pregnancy. You'll have polyhydramnios because of weight gain also, which might lead to gestational diabetes and leading to polyhydramnios. And there are also sometimes because of the large babies, you have increased risk of delivering through cesarean section. In normal delivery, there is a risk of shoulder dystocia. And coming to if you gain less weight in pregnancy, there is a chance of risk of IUGR, that is intrauterine growth restriction. So depending on the amount of weight you gain through pregnancy, either you gain more or you gain less, your caloric intake is determined according to the gain throughout your pregnancy. If you're gaining more, we try to restrict your calories and we try to give a proper advice so that you won't gain more weight and you're properly monitored throughout the pregnancy. If you're gaining less, it might lead to intrauterine growth restriction of the baby. So we try to advise you for more calories and good diet so that you gain more weight and it won't affect the baby. And how to maintain the normal weight throughout the pregnancy is next. So generally, we advise for a well-balanced nutrition. The caloric intake should be normal, that is around 1500 calories per day, and restricting all the white sugars and white flour, and tell them to have a well-balanced nutrition with good amount of fruits and vegetables, and try to inculcate at the early pregnancy only in the walking from the very early pregnancy, and pelvic floor exercises and strengthening exercises in the later part of the pregnancy. And throughout the pregnancy, we'll tell them to be active, so that it will help also to deliver normally. Thank you, and follow me for more content.